It's been 16 days of activism against sexual and gender-based violence that has drawn support from many segments of the society. One of the major areas of concern addressed as part of the 16 days activism is the campaign against female genital mutilation that has remained an unhealthy practice in some communities. Tonight, we intend to look at the role of healthcare professionals in the campaign against female genital mutilation, courtesy of global media to end female genital mutilation. My name is Abubakar Muhammad Musa, and it's always a pleasure to have you join us on Meeting Point. Our guests tonight are drawn from Rescue Health Initiative Africa. I have with me Nas Usman Albishir Munir, who is the program manager of Rescue Health Initiative Africa. It's a pleasure to have you join us on Meeting Point this evening.
Thank you, sir.
I equally have with me Nas Reuben Markus Zirahgi. He is the Information Publicity and Advocacy Manager of Rescue Health Initiative Africa. Nas Reuben, it's a pleasure to have you join us this evening.
Thank you very much.
All right. Okay, gentlemen, you're welcome to Meeting Point once again. Let me start with you, Nas Albishir. Can you briefly explain what is 16 days of activism?
Thank you very much. I am Nas Usman Albishir Munir, the Program Manager of Rescue Health Initiative Africa. 16 days of activism is a kind of international campaign against violence to women. So 16 days of activism runs every year from 25th of November to 10th of December. So that's how it runs every year. And 16 days of activism was first initiated by some group of women who belong to a group we call the Women Global Leadership Institute at Rutgers University in 1991. Such campaign was actually accelerated, and lots of organizations since 1991 have joined that campaign, because about 6,000 non-governmental organizations participated in the campaign since 1991 from 187 countries of the world. So that's why today Rescue Health Initiative Africa is also participating as part of those organizations to achieve or to actually enjoy the 16 days of activism. That's about 16 days of activism.
Okay, thank you so much. Okay, let's now turn to Nas Reuben. Nas Reuben.
Yes, sir.
What is female genital mutilation? Is it a social problem or a health concern?
When we talk of female genital mutilation, it's both a social and health concern, because it has both social and health related or physical complications. So when we talk of female genital mutilation, it's any procedure. So any procedure that involves total or partial removal of female genital or external genitalia for non-medical purpose is termed as what? Female genital mutilation. And some people also call it female genital cutting, that's FGC or FGM. So it's been done for no medical purpose, and it reduces what? The function, normal function of female genital genitalia. So you see, that's why we always discourage such kind of procedure. So that's all about female genital mutilation.
Okay, thank you, Nas Reuben. Let me now come back to Nas Albishir. Can you tell us the classifications of female genital mutilation?
Thank you. As far as female genital mutilation is concerned, we have 4 different types. So it is classified into 4. The first, the type 1, is what we call clitoridectomy. The suffix ECTOMY implies removal in the medical term. So removal of the clitoris, either total or partial removal of the outer clitoris. This is what we call the type 1.
Do we have an inner clitoris?
Yes, because,
okay. Okay, go ahead.
Okay.
So that I don't interrupt.
Yeah, so that is the outer, meaning the visible part.
Sure.
Good. Then the second one is what we call the type 2. The type 2 implies removal of the clitoris, that is the outer clitoris, as I have explained, and the labia minora or labia majora or both. So the type 2 can be in two formats. It can be the clitoris removal plus labia minora, or clitoris plus labia minora and majora. The third is what we call infibulation, and is simply narrowing the vaginal orifice by creating a kind of covering seal using the labia majora or labia minora to create a kind of what, to narrow the vaginal orifice. So that's what we call infibulation, is the third type. And the fourth is any other harmful, procedures to the female genitals for non-medical reason, which include either piercing, either, stitching or tattooing. Some cultures do that. Is what we call the word type 4. So these are basically the 4 types of female genital mutilation.
Very interesting, I must say. Now, Nurse Reuben,
Yes.
are there any clinical complications of female gender mutilation?
Oh, wow. Thank you for this question, because it's a question that people need to know. There are so many complications related to these illegal procedures, because like cutting of normal healthy genital tissue of female, it's like you are doing harm physiologically, is you are doing harm for that a particular victim, and there are complications that may arises, be it immediate or long-term complication. So the complications are divided into two.
Okay.
We have immediate complication and we have long-term complications. Immediate complications are the complication that arises immediately or within a short period after the procedures.
Okay.
While the long-term complications, they are the complication that arises in the nearest future. So it's take a longest time before it show up. And the immediate complication, it can be sometimes there is bleeding because it involves cutting of the external female genitalia. So whenever there is cut, for sure there is going to be bleeding. So if there is bleeding, it can lead to hemorrhage, loss of blood, which can lead to anemia. And sometimes when there is excessive loss of blood, it can lead to shock. And when there is shock, they don't know how to treat, most especially the traditional circumciser, because we don't even have non-traditional, because mostly traditional, and in some countries, some medical practitioners are doing it, which is very illegal. So they don't know how to treat the shock safe, so it can lead to death. And there may be infection. Infection might come it because there's use of what? The equipment used, they are not sterile. So, and it's being repeatedly used on some others, on different people. So it can bring infection to the victims. So it can be vaginal infection, it can be tetanus and whatsoever. So these are sometimes there is going to be fever, there is pain. So these are the immediate complications that arises during female genital mutilation. While the long-term complications, it's categorized based on problem. We have urinary problem. Sometimes there's going to be urine retention. Sometimes there's going to be a painful urination, and sometimes there's going to be urinary tract infection as a result of the female genital mutilation. And we have menstrual problem. Sometimes the victims, they are going to experience painful menstruation because of as a result of the effect of the female genital mutilation. And we have a psychological problem, which entails of depression, anxiety, isolation. It's almost related with the one of rape, and it's long term. It's going to be there, and it's going to affect the psychological, the individual, to the extent that sometimes it may even lead to suicide. So, and we have complications.
Oh, you mean it can cause suicidal tendencies?
Sure. Because of the depression. When someone is depressed, sometimes is isolated, there are negative thoughts that will be coming up in his mind, and he might have decided to commit suicide. And we have complications.
So it can be as bad as this?
Yes. We have complications during childbirth, because considering the types of the female genital mutilation, So there can be complications. There's painful delivery, and there is going to be, though most delivery are painful, but it's going to be very complicated, the delivery. It can result to what? Postpartum hemorrhage during the delivery. And we have vaginal problem. The itching might arise with time. There's going to be what? Bacterial vaginosis arising, that's within the female genital genital areas, and there's going to be scars formation. So it's just like a spot that is going to be like an outgrowth. That's the scars formation, and sometimes there's going to be depressions, because all these things can lead to depression, and there's going to be repeated surgery. That's because when they fused it, as in the type 3 female genital mutilation, so later in time they have to do surgery in order to open it for child delivery and sexual intercourse in marriage. So these are the long-term complications of female genital mutilation. Though there is one again which is very important.
Okay.
There is going to be loss of sensation.
Oh,
yes,
really?
Yes,
Okay.
there's going to be loss of it. Whenever, the most sensible organ and the female genital, that's external genitalia, is the clitoris. And think of that's when it's being caught. So you are going to lose sensation. So the sexual intercourse, even in marriage, is not going to be pleasurable.
Enjoyable, I
Yes,
understand.
yes. So
Okay.
that's one of the most important things. So that means
I don't think
victims
a
are
lot of people are, knowledgeable of this particular aspect.
No, many. Some people, there's misconception that's, girls, sometimes they will be saying, females that have been circumcised are more sweeter. No, this is misconception. But in the actual sense, there is going to be loss of there's going to be reduced pleasure and libido. So that's what arises as the long-time complications of female genital mutilation. Yes.
It's I must say, it's very interesting that you are informing, a lot of people out there on the, negative effects of, clinical complications associated with female gender mutilation. Thank you so much, Nurse Reuben. Let me come back to you, Nurse Albishir. Can you shed more light on what he had just talked about?
Yes. It is very important that we should note, right from the definition he gave, that it is done, female genital mutilation is done for non-medical reason. So the word or the phrase non-medical reason should be capitalized and underlined. It might be performed by a healthcare provider, either a medical doctor or a nurse or a midwife, but there isn't any scientific backing for the medicalization. Sure. Because there is a kind of misconception that, I need to explain here because you have given me the chance.
Yes. Why not?
Yeah. So they used to say, some that have the misconception, they used to say, maybe if you carried out the procedure in a very hygienic area, maybe in the hospital, in the theater, or whatsoever, there will be less risk for infection. Yes, it's agreed, for the sake of argument, that there will be less risk for infection. But let's call a spade by its name.
Okay.
A spade is always a spade. Whether it's done in the bush or in the hospital theater, it has no medical justification.
No, not at all.
No reason for the medicalization.
Yes.
This is something I would like to shed more light on. Secondly, regarding the delivery, you said, you mentioned about the difficulty in parturition. So most importantly, there are 3 P's that I used to call them fundamental P's if it comes to delivery. We have the passage, the passenger, and the pressure. The pressure that the fetus exhibits in the labor mechanism, you understand? Once there is any problem with that, then definitely we are going to have issues with the delivery. The pressure, decreased pressure, pressure of the distance. Then the second is the what? Is the passage. It talks about infibulation, which which I said is the what? I was the one that even talked about it. Just like for what? Yeah, narrowing of the female genital.
Okay.
By creating a kind of covering seal. By using either labia minora or majora or both. So once you narrowed that passage, the vaginal orifice, once you narrowed it, there will be a kind of difficulty in, the size, you understand, is going to decrease. Hence, the woman would be more likely to have a procedure which we call, episiotomy, a kind of expansion of the female genital, you understand, of the vaginal orifice, to allow delivery to occur. Usually in primary gravida, it used to happen. But there's more tendency once you narrowed it, once the vaginal orifice become mutilated, so there's more chances of the woman being, being cut during the delivery. That is one. So, and we need to understand.
Are you talking about CS? You have to undergo cesarean?
This is, is delivery per vagina.
Okay.
So, at times we need to increase the vaginal orifice to allow the fetus to be delivered, mostly in primary gravida, mostly. So, increasing that vaginal canal, the passage, you understand, is a kind of procedure. That one is a medical procedure done to many women. But there is high risk of a woman to get that procedure done to her if she is
that the only
mutilated.
Way out?
That's the only way out.
You mean the mother cannot be induced? Alternatively,
even if the mother is induced, this is talking about the passage.
Okay.
The space.
All right.
The space is too narrow, so you need to increase, because already the baby has crowned.
Sure.
Understand?
All right.
So once it's not crowned, then it could be an maybe she will undergo elective CS. You understand, or emergency, as the case might be.
Sure.
So this is very important to note this, and we should know that all these procedures, either carried out by medical professionals or non-medical professionals, has no any benefit as far
at
as
all. Not even
as
an
far
iota?
as scientific. You understand?
As far as science is concerned,
yeah,
no benefit at all.
No benefits for the procedure. Nice.
Very interesting, I must say. Okay, Nurse Albishir, what other efforts is the Rescue Health Initiative Africa, doing to, reduce this menace drastically? Aside having, this studio-based discussion program, we're having this interactive session for you guys to pass, a very vital message to the larger society. So aside this, what other efforts are you making to change the narrative?
Okay, we do a lot of efforts. The first is educating the society about how harmful such FGM is. We actually use each and every opportunity that we have at our doorstep to create a kind of enlightenment to whoever person is we come in touch with. So what I believe, information is a key. Once you are able to pass the information to somebody, explain the clinical complications and whatsoever, so that individual, there is more likelihood that there is tendency that that individual may change his attitude. It is very important to note that all culture and traditions are created by man. And it's only man that will change those cultures, particularly the traditions or cultures that are harmful to that individual, as far as it is not a divine law. So this FGM is a menace. It has no health benefit. So we create awareness. We tell people this is FGM. Know more about it. We post that one using all this social media. Today the world is a kind of global village. So you shouldn't underestimate or underrate the power of social media. We use our social media effectively. The Twitter, the Facebook, and whatsoever. We always post on that. So we go to schools. We educate, students and pupils about this harmful practice. At least let them have the knowledge. And there are a lot of things, in fact. Looking at the time constraints, I know just a few minutes, people will start telling you don't have time, and I know there are a lot of things that we might like to add. So this is a bit about what we have been doing.
Nurse Reuben, can you shed more light on, the efforts personal effort, not necessarily collective effort,
Yes.
as an individual,
Yes.
because this is a serious health concern. So
Sure.
what are you doing as an individual to change the narrative?
Oh, as an individual,
Within your immediate
Yes.
family, friends, and loved ones,
Sure.
not necessarily the larger society. Because if you start from them, it will definitely get
reach.
across to other
Yes,
people.
because it always have its process of going.
Exactly.
long way. So in
tell
my
us.
own personal effort, sometimes more especially my relatives and closest by friends, I organize a focus group discussion. We discuss, and they will ask so many questions, and I give them reason with scientific backup, to the extent that they get convinced that this is the reality and agree to the reality. And even yesterday I had to I educate people on my WhatsApp status, particularly on female genital mutilation. And
I saw
many
it.
people many people were like interested, they love it, they asked me so many questions about it. I've given them answer. Though I find one tough lady that says she's going to do it for both her male child and female child.
Yes, that lady.
Yes, you can remember that lady.
Yeah,
I have to
yeah.
take it to our group, that's to our organization, for profound discussion. No, some people, she knows the fact. I said she should go over and over my presentation, because I've clearly indicated the benefit, the negative impact,
effects, yes, of
the
it.
complications that may arise. I said doing it to the child, is a child that doesn't know anything. It's a violence against children and it's molestation. It has legal backup. So some of us say this type of people, they need to be reported, because there are people that they knows the truth, but they are trying to shun the truth. So shunning the truth is like maltreating that child, the victim, because it's mostly on the children from 5 years to adolescent. So that's it.
Very well, I must say, Nurse Reuben. Okay, I wish we could continue this discussion over and over, because it's very insightful, I must confess. Okay, now, briefly, Nurse Albishir, are there any legal implications of female gender mutilation in Nigeria?
Yes, of course, there
In
are.
a nutshell, please,
Yeah,
because
there
of
are,
time
James,
factor.
There are, of course. Like even if you read in the Nigerian constitution, there are some statements there that are said to be ambiguous. I have to say that one. Like in the 1999 constitution, section 34, clearly indicates that no person should be subjected to any form of torture, inhuman, or degrading punishment. Similarly, in 2003, I think the Child Right Act was passed, where in section 11B it's clearly mentioned that no child should be subjected to any form of torture, inhuman, or degrading punishment or treatment. Then all these, are ambiguous statements, because explicitly the term or the word female genital mutilation was not mentioned. So in 2015, there was a kind of amendment where clearly we have what we call the Violence Against Child Act, clearly mentions that once an individual is found doing that procedure to innocent people, that individual will be subjected to a kind of imprisonment of not less than 4 years here in Nigeria, in UK 14 years, if you have to compare, and or he should pay the fine of 200,000 naira or both. So, and once you aid or supported that individual, the law says that you are to pay a fine of 100,000 naira or imprisonment of not less than 2 years.
For both the perpetrator and the accomplice?
Yes.
That's great. Nurse Reuben,
Yes.
what is your call to health workers and communities regarding female gender mutilation? Just briefly, because time is not on our side, like I said earlier on.
Okay, no problem. No, female genital mutilation is illegal in many countries, and medical providers who perform that are violating the laws. So, and medical providers who does that are violating the fundamental rights, reproductive rights of an individual. So, so first and foremost, I'm calling on health workers, healthcare workers, from nurses, midwives, gynecologists, and doctors to use their influence to fight or stand against female genital mutilation, not within the jurisdiction of their community, but even to their colleagues at working place, and to extend it because it has no medical benefit, which will do no harm to individuals, most especially children of 5 and to adolescent, which doesn't know. They don't have choice. It's like they are being forced sometimes.
They don't know they're left
They
or
don't
they're
know
right.
they are left or right. So I'm calling on the community, more especially men, to involve in the fight against this kind of barbaric and deeply harmful practices. Thank you.
All right. NTA on its part will urge Nos Albishir and Nos Reuben to sustain this commitment in ending the menace of female gender mutilation. At this point, I'd like to say a very big thank you to Nos Albishir. Nos Usman Albishir Munir is the program manager of Rescue Health Initiative Africa. Thank you so much for sharing your wealth of experience with us this evening. Thank you once again.
Thank you.
I equally say a very big thank you to you, Nos Reuben, for being part of Meeting Point this evening.
Thank you very much, sir.
And that brings us to the end of Meeting Point for today. My name is Abubakar Mohammed Musa, and I'm urging all of you out there to say no to female gender mutilation because it's a terrible practice. Good night.